Camp in Calaveras County. How y'all doing this morning? Here we are. So I want everybody to pinch themselves because we thought this deal would never happen. It's not a mirage, it's here. We have the clinic. How about that? Since I've been assigned up here for 7, 8 years, we've been talking about this clinic. In fact, I learned a lot standing around here talking this morning. Over here we had a conversation. How many people live in Calaveras County? I heard a high of 58, 60,000, 48,000. I always call it 60,000 when I'm talking about Calaveras County because I like to round up. And I want you to all be as big as you can when I'm trying to get capital to do stuff for you all out here. So this clinic is going to be an amazing addition to the healthcare delivery system that we have at Mark Twain Medical Center here in Calaveras County. And certainly for the folks that live closest to us, because we have other clinics, as you all know, around this county. The other thing I learned this morning standing around here is Mr. Dalton started in San Francisco as a construction worker digging tunnels. Is that correct? How about that? Very successful story. I love it. I love it. I also learned that we put up a sign up here that says coming. Opening in 2013. The James Dalton Medical. We didn't make it. We're only 7 years late, but we're here.
I'm just glad you didn't share that story about being in jail. Boy, that would have been embarrassing. Way to go, Doug. All right. Wow. Pretty impressive when you stand up here. There's a lot of people that came out to celebrate a pretty cool day. So I want to thank everybody for being here. We lucked out with weather. Just a heck of a day for a heck of an event. We'll be doing some tours of the building afterwards, so you can take a look at the inside. Pretty amazing place. So thanks again for being here. So I have the pleasure of going through a list of many people that we need to thank. And for the people that I forgot, I'm just going to say right now, sorry about that. Don't take it personal. But I'm sure there's one or two out there. But it definitely took a cast of thousands to make this place happen. I think a lot of discussion earlier on, as John alluded to, about how long this took. I haven't even been here a year, so I can't really, It was a long 11 months for me, but that doesn't quite add up to what you guys went through. So anyways, I'd like to start out with the maintenance crew. A couple of rascally guys in the back there. We got Craig and Matt. Ryan's really earlier. And just to show you that there's no rest for the wicked. Ed, the leader of our plant ops team, is over in Copperopolis meeting about the new clinic that we're going to put in Copper. So no rest here. Chris Harris, I don't know if you're here from the EVS crew, housekeeping, helping keep the place clean and get it all spruced up for us today. All of our providers, of course, I think you've all stood. And Dr. Rogalski must have known that I was going to do this because I don't see him out here. But it is his birthday today, so I guess I won't sing happy birthday since he's not here, and I don't want you all to run away. He's in surgery. Well, that's a fitting place for an orthopedic surgeon. Yes, very good. Also, Marina Bolin and her team of supervisors. I know I saw Dawn and Amber and Denise out there. It's been a long road. Yep. Finger pointing over there. Our partners that help us put this place together, Descor Builders and Aspen Street. If you don't know the story, if you can imagine this being about 15, 20 feet stacked with rock, that's one of the reasons why 2013 didn't happen or October. But here we are, we're opening, so we won't talk about that anymore. Dr. Griffin. My partner in crime. A lot can be said about this man, but he's been right by my side and a huge help to bring this project home. So I very much appreciate that. We have our community board members here. I know I saw Chris Champlin. Yep, very good. Thanks, Chris. And Kathy Northington. Nick Baptista's out there taking pictures. Thank you, Nick. Dr. McCoy. somewhere. All right, Dr. McCoy's out there as well. Somewhere out there. And Taliba Al-Rafiq is also on our board. Lynn Reed, I think I saw Lynn sneak in. Very good. Thanks for being here, Lynn. And special thanks to Deirdre and Ned, the Dalton family. I think a lot of people put some effort into bringing this vision home, but it was the gift that your family brought to us, that Jim brought to us, that really made this happen. So thanks for being here this morning. All right, so it took a lot more than just vision. It also took the work of our foundation. And I think Greg and Nuala are here, the Jordans. I know you guys put a lot of effort into this, and thank you very much for your foundation leadership to bring this home. $2.4 million was raised by the community for this project. 2.4, thank you. Yeah, absolutely. That deserves a round of applause. So in total, it was about an $8 million project. So that's about a third of the total cost of this project raised by philanthropy. I think that goes to show the community support and the desire for improved access and improved quality of care. Pretty amazing. For me, as John mentioned, I've been here just about a year. This opening really, to me, is a symbol of a new beginning for Dignity Health. New beginning for Mark Twain Medical Center. New beginning for Calaveras County. And I want to also thank my partner, I got a lot of partners in crime. I don't know what that says about me. But Dr. Smart, I just have to say that your partnership and frankly your friendship is huge. And I think the future in Calaveras County for healthcare is going to be a pretty amazing thing when we put our heads together. So a lot more exciting stuff coming. As I mentioned, Ed's out in Copper talking about a new clinic out there. We got the new clinic out in Valley Springs run by the district and Dr. Smart's team. It's a good place to be. It's a bright future for us. So speaking of new beginnings, I'm going to hand my microphone off to a gentleman that I think many of us know and appreciate that he's come back to join us here at Mark Twain Medical Center. So without further ado, I'd like to bring Dr. John Kirpin up to the stage. So Dr. Kirpin's agreed to be our medical director for primary care, and let him say a few words. Thank you.
I'm John Kirpin. Thank you for coming out. It's been a long time coming. Randy, you can have my job anytime you want. First of all, can the staff that's working here at the James Dalton Clinic come up here? I just want everybody to see your faces. Don't be shy. Come on up. Just so everybody can see our staff. If you guys need anything, please call us. Spread the word. We're open for business. I've already been asked today if we're open for business. We opened last Thursday. Okay, you guys, thank you. So I moved here in 2002 with a wife and 4 kids from Alaska, and I had the great pleasure of meeting Jim at a social event almost immediately in the first few weeks we were here. And true gentleman, told great stories. My wife and I were reminiscing last night about him talking about the land here, and there's something to it, how he loved it. One day I was working over at the other clinic, and Jim Dalton's on my schedule. It's like, oh, this would be good. He's always good for a story, and he wanted to talk about mammograms. And I thought that was a weird thing. We did absolutely no medicine that I remember. And he asked my opinion on a new mammogram unit, and I said, I think it'd probably be a good thing. And a couple of months later in the newsletter, there was a new mammogram unit at the hospital. Didn't make the connection. A few years later, he came by and wanted to talk about if the hospital needed an MRI, not one in a trailer that came and went, but just wanted for the hospital. I thought, I think that'd be a good thing, Jim. Didn't do any medicine. I'm assuming I didn't bill him for anything. And then you get the newsletter a few years later, and we got an MRI. I have no idea if he's involved in it. Don't know if he had any part in it. There's a coincidence, though. He was, in my opinion, a silent advocator for Calaveras County health in Calaveras County. I don't remember him ever taking any credit for anything, but he's responsible for a great deal of what's happening here. And so, to Jim and his family, thank you. And we will try and honor him by running this with kindness and in a gentle manner in his memory. So thank you.